Hello everyone, I am Michelle Jane Sevilla, student nurse from BSN 111D. And for today, I will be performing an eye assessment. So our eyes are actually the main organ for our visual system. They give us the ability of vision or the ability to perceive light, so it is important that we have our eyes corrected to improve the quality of our everyday life. So the first thing that we need to do is to review the client's medical records, and this will allow me to get the basic information about the client. After that, I will determine the scope of assessment needed and prepare the necessary equipment prior to meeting the client. So I have here my pen light to shine light to the patient. Next is a Snellen's eye chart, eye cardboard, gloves if necessary, alcohol for disinfection, ball pen, and a jot down notebook. So now all of our equipment is complete. I will just perform hand hygiene to deter the spread of microorganisms and wear gloves if necessary. So good morning, ma'am. I am Michelle Jane Sevilla, your student nurse for today. And can you please state your name and your birthday, please?
My name is Princess Jane Sevilla, and I was born on September 21, 2000.
So, Michelle De Libero, how do you like me to call you?
You can call me Jane.
Okay. So, Miss Jane, for today I will be assessing for your eyes and visual acuity. That means I will be performing some vision tests. Will that be okay? Okay. If you have any questions, feel free to ask. And do you have any clarifications?
None.
Then I will now close the door for your privacy and confidentiality. So are you comfortable with your position right now?
I am.
Okay. Then I will now begin assessing your eyes. So if I may just ask, do you use any lens or contact lenses or graded glasses? Okay. Now I'm gonna have to ask you to stand up. Please stand up. Okay. So what I need you to do is to use this card to cover your right eye. So you can do it like this. And then try to read the letters that are written in the Snellen's chart just up until the letter that you can see, okay? And then after doing that, with your right eye covered, you have to do it again with your left eye covered. And for the third part of the procedure, I need you to read the letters and the Snellen's chart with both eyes uncovered. Okay, here, place it on your right eye. Now you can start reading the letters.
E F P T O Z L P P E C F D E D F C Z E F P L O P Z.
Okay, now do it on your left eye covered.
E F P T O Z L P E D P E C F D E D F C Z D F E L O P Z D.
Okay. Now, I'm gonna get the very card and do it with your both eyes uncovered.
E F P T O Z L P P E C F D E D F C Z D F E L O P Z D D E F P O T E C.
Okay, thank you. You can now take your seat, Miss Jane. So now I'm going to perform selected vision test. So ma'am, I need you to tell me how many fingers I am raising, okay? So how about this?
1,
This.
2, 3, 5.
Okay. So another one, I need you to tell me what direction I am pointing my finger at, okay? So can you see this? Where is it pointing or where am I pointing?
To my right.
How about this one?
Up. This. Down. Left.
Okay. So this time I need you to tell me if you can see the light, okay? And how about this? Can you see it? Can you see it? And where is the light coming from? How about here? Where is the light coming from? Okay, ma'am. So now I need you to, uh, what I need to do is to cover your right eye using this card and look directly at my nose. At the same time, I will also cover or close my eyes directly opposite to your covered eye and look directly at your nose. Then I will hold this pen light and with my fingers extend my arm and move the object into the visual field from various points in the periphery, ensuring that the object is at an equal distance from you and me. So after that, I'm going to ask you, ma'am, to report to me when the moving object is first spotted. Okay, you can say stop when you first spotted the object. Okay, so I will do it now. Okay, then I will do it on your other side so you can cover your left eye. Okay, so next I will visually inspect your eyes. Can you do that? Okay, so I see that your eyebrows are evenly distributed and lightly arched. So can you raise your eyebrows for me like this and down like this? Okay, so and then your eyelashes are both evenly distributed and curls are slightly and they curl slightly upward. So can you now close your eyes? So your lids are symmetrically and no discolorations and lesions. So now can you now open your eyes? Then I will inspect the area over the lacrimal gland and lacrimal sac for swelling. So there are no edema, no swelling, and tearing of the lacrimal ducts. So now I need you to look up to assess the sclera and bulbar conjunctiva. Okay, so then I will invert the eyelid to assess the palpebral conjunctiva. Okay, so now I'm going to be inspecting each iris and pupil, so just look straight into my eyes, okay? And I'm going to use my pen light to check your cornea and lenses for any opacity, clarity, and texture. Okay, there are no opacities. And this time, I will also assess each pupil's direct and consensual reaction to light. So now I need to close the light, and after that, I need you to look into the distance, okay? Now I will shine a light obliquely into each pupil in turn. After that, I will look for direct and consensual reactions. Okay, so what I did is I showed the light in your right eye and then it constricted, and that's the direct reaction. And for the consensual, it means that when I showed the light in your right eye, the left eye also constricted, which is pretty normal. So now proceeding to the assessment of your pupil's reaction to accommodation. So now I need you to look or focus your eyes at the tip of my pen light and look at the wall of my back, okay? Now look at the back. Again at the pen light and at the back. Okay. So next, I will be performing the Hirschberg test. So I'm just basically gonna shine my pen light in your eyes and then look for a reflection of it in your turnings. So just look straight into my eyes, okay? Okay. So now I will be performing the cardinal fields of gaze test. I need you to follow the tip of my pen light with your eyes only, not moving your neck with it. So just the eyes, okay? Okay. So now we'll proceed to test for your convergence. So just simply follow the pen. Okay, thank you. So this time, ma'am, I'll be summing up everything that we've covered. So for your visual acuity while you were reading the Snellen's chart, the result shows that your right eye's vision is 20/25, your left eye is 20/30, and both your eyes is 20/25. For the inspection of the eyes are aligned and symmetrical, eyebrows are evenly distributed and arched, eyelashes are evenly curled upwards, the eyelid skin is intact, lids flow symmetrically, no discharges and discolorations. So we have normal blinking, which is at 15 to 20 blinks per minute. And as I was palpating for your lacrimal gland and also lacrimal ducts, there are no edema, tenderness, or swelling or tearing. So sclera is white, which is normal. So bulbar conjunctiva is good. Iris and pupil are both normal, so no opacities. And pupil is 3 millimeters, which is normal too. So for your pupil's reaction to accommodation, it is normal. So the test is where I ask you to look at the tip of the pin and at the wall behind me. So for the cardinal field gaze test, both eyes are coordinated, no jerky movements, so everything is pretty normal. So that is it, everything so far. So there's no problem with your eyes. I'll just advise you to minimize the exposure to phone screens and to continue to take vitamin A rich food, which is good for your eyes. So take a rest after hours of spending time on your phone. So do you have any questions? Okay, so that's it for our assessment. Thank you for your cooperation. So after the test, perform hand hygiene. So that's it for the eye assessment. Thank you.